we are going to look at the radiological features. The radiological features of the major respiratory distress disorders. So, to begin with some questions, the first question is, in case of the meconium aspiration syndrome, what are the findings? So in this video, we'll find out this answer as well as learn in detail. To begin with, we'll look at the congenital diaphragmatic hernia. So we start with the congenital diaphragmatic hernia. So this is basically, there has a mediastinal shift. There is a mediastinal shift. Then there is also the bowel loops of the left hemithorax. There is bowel loops of the left hemithorax. Next, as we move, we have the respiratory distress syndrome. So respiratory distress syndrome. So in terms of respiratory distress syndrome, there's nothing but there is a low lung volume. There is a low lung volume. Next, there is also a symmetric. There's a symmetric ground glass. Symmetric ground glass opacity. So this is nothing but the reticulogranular pattern. Reticulogranular pattern. Next, there is also the air bronchogram. Air bronchogram and the white out lung. The white out lung. This is all features of the respiratory distress. So we saw there is a low lung volume, there's symmetrical ground glass opacity, there's air bronchogram and the white out lung. Next, we move on to the meconium aspiration syndrome. So in terms of the meconium aspiration syndrome, what are the findings? So here there is hyperinflation. There is hyperinflation. And there is also the patchy infiltrates. And there is a coarse streaking. Now, to answer our question, we asked one question. So that question was related to the respiratory distress syndrome. The respiratory distress syndrome. So what does it include? So respiratory distress syndrome, it includes the low lung volume. Next, there is a symmetric ground glass. There is a symmetric ground glass opacity. And this is nothing but a reticulogranular pattern. A reticulogranular pattern. And then there is a air bronchogram as well as presence of the white out lung. So there is a white out lung which indicates the presence of the severe disease.